there's a difference between what a habit is and what an addiction is. A habit can be like a persistent, behavior that you perpetuate, and it might even have negative consequences. But the difference between that and an addiction is that addiction entails a psychological and generally also, sometimes also, a physical dependence. And there's a discomfort when we don't engage in the addiction, right? That sense of withdrawal or like craving or yearning. It's something that we do repeatedly despite negative repercussions. Addictions are things that typically escalate over time, whether it's behavior, the frequency of use, the dosage of use in the case of substances. And we do this irrespective of escalating negative consequences, right? I think there's also like a compulsivity to addictions that's different from just a bad habit, where there's this physiological, again, or psychological need for engaging in this habit. And when we don't do it, there are symptoms, right? Anxiety, irritability. There's physical symptoms with substances like tremors or nausea upon withdrawal or abstinence. That is the state of being addicted, right? And I think addiction, and I've said this many times, is something that is a self-diagnosis. Like only you can diagnose yourself as to whether you are engaging in addictive behavior or just a bad habit. And I think in trying to figure that out for yourself and distinguishing a habit from an addiction, think about choice, right? Like with habit, choice plays a larger role. With addiction, part of addiction is the removal or the denigration of choice in the matter, to the point where it doesn't feel like there is a choice, like there is such a compulsion that it just happens. And
you're being automated.
Your wish to have a choice over it, it like happens no matter what. I mean, I think that's a good kind of litmus test for figuring it out. So examples, right? Like a bad habit would be like you just put your dirty dishes in the sink and you don't wash them, or like you don't brush your teeth before you go to bed or something like that, right? Not great. These are not awesome habits, but is there a compulsivity around it? Is there a sense of unease when you wash your dishes?
Right.
You're not just leaving them dirty in the sink. No,
right.
So that's the difference between, something that would be an addiction.
So you would put gaming more into the addiction category for a lot of people.
I don't know. Only he has to ask himself that.
Right.
There are people that play video games and who are not addicted, and there are people who are addicted. And often the amount of playing isn't necessarily the determining factor.
No. I think that's the problem with smartphones. A lot of people are addicted to the tech now, right? It's low level, but
sure.
Like they can't put their phone down. They can't stop scrolling.
No.
Right.
Of course not, right? And it's not, is it low level?
No, maybe not.
And this is, I've been banging this drum for a while, but let's expand our notion of addiction and how we think about addiction. Like addiction isn't just alcoholics and drug addicts or people that, lose all their money gambling. It is, the inability to put down the phone can be an addiction.
Definitely.
When it is, taking you out of the present and robbing you of the experience of being in your life. Right? Video games are, another screen version of that where there's an engagement on behalf of the individual, but certainly, plenty of people are addicted to video games.
Yes.
And the fact that this guy cratered his Ironman training because he got all caught up in a video game. I mean, that's what it sounds like. I don't know the details of it, but it sounds like an addiction to me. But again, it's not for me to diagnose this person.
Self-diagnose.
Questions to ask that this person or whoever is relating to this should ask themselves is, do you feel like this is a compulsion? Do you feel like your engagement with it is outside of your control? Is it something you covet? Is it something that you, tell lies about, that you rationalize or downplay? And then getting honest about what the costs of this behavior are to yourself and also to other people, right? And then the other question I had is kind of going behind the question. Like the question is this a bad habit or an addiction? Like, why is he asking this question? If he's asking the question, it's probably a problem. If it's not a problem, you're not asking this question.
No.
And there's sort of a light dusting of hopefulness that like, I'm going to say this is just a bad habit and don't worry about it. Like, does it matter what I say? Is this a bad habit? Is this an addiction? Because my sense is that this is interfering with this person's well-being, right? And he knows it, and he's looking for an excuse or some way to rationalize continuing to engage in the behavior, which is, to me, indicia of it being an addiction.